Clinical Pharmacy Adherence Optimization Part 5. In this video, I'm going to talk about strategies for enhancing adherence to pharmacotherapy. Although pharmaceutical care plans should be individualized, some adherence promoting strategies tend to be helpful in the majority of patients. Whenever possible, the pharmacist should strive to the following. First, to promote self-efficacy to the patient. The pharmacist must encourage patients to assume an active role in their own treatment plans. The more confident people feel about their ability to manage a problem, the more likely they will be to take positive action to solve the problem. Involving patients in decisions about their care is important for promoting self-efficacy. For example, a study was done by Nesman and colleagues showed that patients with hypertension who were highly involved in decisions about their therapy and trained to take their own blood pressure had significantly better health outcomes than patients who did not have these characteristics. The authors attributed the improved outcome to the patient's ability to make choices about healthcare decisions and following monitoring plan. Second, the pharmacist must empower patients to become informed medication consumers. A pharmaceutical care plan to enhance adherence should first focus on educating the patient and family members or caregivers about the patient's disease and medications. Pharmacists should provide both written and oral information to address such basic questions. For example, what is the disease? Which treatment have been prescribed or recommended, and why this medication was prescribed? What is the patient's role in managing the disease? Which adverse effect may occur? Actually, perhaps surprisingly, the amount of factual information that a patient has about his or her medication is not highly correlated with the adherence behavior. Instead, information that is directly useful and meaningful to the patient and clear instructions for medication use are more significant. Opportunities to impart functional knowledge begin with the physician and/or nurse at the time of the initial prescription and should be reinforced by pharmacists when the prescription is filled or refilled. Third, the pharmacist should avoid fear tactics. Scaring patients or giving them dire warning about the consequences of less than perfect adherence can backfire and may actually worsen adherence. A more constructive approach is to help patients focus on ways to integrate medication taking into his or her daily routine. Fourth, pharmacists should help the patient to develop a list of short-term and long-term goals. These goals should be realistic, achievable, and individualized. The pharmacist can also make contractual agreements with the patient to encourage development of constructive behaviors, such as getting more exercise or beginning a smoking cessation program. Fifth, the pharmacist should plan for regular follow-up. The pharmacist should plan to interact with the patient at regular, usually brief intervals to reinforce the adherence plan. For example, brief appointments can be scheduled when patients visit the pharmacy for prescription refills. The plan should be adapted to the patient lifestyle and be re-evaluated from time to time to adjust for life changes, such as aging or a change in work or school schedules. If possible, the time for counseling on adherence should be separated from the dispensing and pickup functions. Number 6 is pharmacists have to implement a reward system. This might not be applicable in all cultures. Giving prescription coupon or specific product discounts for successfully reaching a goal in the treatment plan can help to increase adherence, particularly in patients with low motivation. In the next video, I will talk about considerations for special populations. Thank you.